Good morning. Welcome to Investigative Methods for Science Journalism. We're 4 recent winners of the AAAS Kavli Science Journalism Awards will share their secrets behind their successful projects. We have Anna Nordbeck, an investigative reporter working for Swedish Public Television, SVT, where she does investigative documentaries and series. She was on a team that won the AAAS Kavli Gold for exposing research fraud at the renowned Karolinska Hospital and Institute, which is home of the Nobel Prize. Charles Pillar is investigative correspondent for Science magazine. He previously worked as an investigative journalist for STAT at the Los Angeles Times when I was there, and Sacramento Bee. And he has reported on public health issues from around the world. He won the AAAS Kavli Gold for revealing that researchers from leading institutions routinely fail to report their study results to a federal government database as required by law. Sarah Wild is a freelance science journalist and author based in Johannesburg, South Africa, who has written for Scientific American, The Guardian, and Atlantic, among others. She won the AAAS Kavli Gold for a Mail and Guardian series on hundreds of unidentified dead in a single province in South Africa. The families looking for them and the forensic anthropologists trying to identify them. I'm Deb Nelson, a freelance investigative journalist for Reuters and associate professor of investigative journalism at the University of Maryland. I previously worked at the Los Angeles Times, the Washington Post, the Seattle Times, among other places. And I won AAAS awards for investigations at the Post into scientific misconduct in the gene therapy field with Rick Weiss, and for Reuters with Ryan McNeil and Yasmin Abutaleb on superbugs. A little bit about the awards. AAAS is the American Association for the Advancement of Science, the world's largest general scientific society. It holds an annual international journalism contest, thanks to a generous doubling of the endowment by the Kavli Foundation, which supports science and public understanding of science. I'd encourage you to enter your own work. The deadline, though, is August 1st. So here's what's ahead today. For the first half hour, we'll take turns talking about how we came upon our stories, why we decided to devote considerable resources to them, what obstacles we encountered, our main findings. After that, I'll ask my co-panelists several rounds of follow-up questions. Then we'll open the microphone for your questions and comments. I'm going to start by talking about The Uncounted, a series I did for Reuters on superbugs. And apologies in advance, I'm going to look at my notes. It is 4 a.m. my body time, and I stayed up last night late to see the US beat England. Woo! Over in Geneva. So I don't want to take you down the dark path that where we might go if I don't have my notes to follow. All right, so the project was the idea of Reuters editor John Blanton. He asked me to join a team investigating development and spread of antibiotic-resistant infections in US hospitals, which played a big role. The assignment, he said, would be to find out how many people are dying of superbugs, why, and what hospitals and government regulators are doing about it. That's an announcement out there. It's like, is that you? Is that you, God? All right. When I'm considering whether to pursue a project, I put it up on this sort of, let me see, where are we here? There we go. I put it up on this sort of mental reality check chart where I balance the relative importance of the story against how difficult it's going to be to document. Do I have the time, the wherewithal, the support, the resources to be successful? I knew patient privacy laws in the US would make this a challenge to get some of the essential information that I needed, but I still thought it would be in the do-it quadrant. So I said yes. Boy, was I wrong. But more on that in a minute. So the best science and the best investigative journalism share this in common. They are both evidence-based. They rely on methodical, independent determination of the facts. So here are my generic what, why, wherefore investigative building blocks to do that. First, document the problem. What happened? How many were affected? What were the consequences? Here we go. Then, dig in deep into the why. And who, part of the why is who and what are responsible. Point fingers if you want to have impact. And then the wherefore, what's the solution? And what's stopping it from happening? We started with a what question that we thought we'd be able to answer pretty quickly. Thought we'd be getting on to the why and what are they doing about it pretty fast. The question was, how many people are dying of superbug infections? The Centers for Disease Control seemed the obvious place to find the answer. It is the US agency in charge of tracking public health threats and had declared superbugs a high priority 15 years earlier and had just published a report, widely cited, that estimated there were 2 million infections every year and 23,000 deaths. They seemed to have the answer we needed. We could move right on, right? But wait, I have found, as I'm sure everybody has here, that the more authoritative, the more widely quoted the source, the more important it is for us to ask that all-important due diligence question. How do they know that? How do they know that? So, we first flipped to the appendix of that report that the CDC put out, where they explain their methodology. Ryan, a brilliant data journalist, spotted the problems first. That 23,000 appeared to be based on a series of pretty extreme extrapolations, conjured out of very little data from just a handful of hospitals. The confidence interval, the margin of error was huge. We both kind of rubbed our eyes. We thought we must be missing something. So I arranged a meeting for Ryan and me with the CDC scientists to go over their math. That's daunting for a journalist. After a couple hours of hashing things out, they admitted the 23,000 was pretty sketchy. Well, that's my characterization. They called the number an impressionist painting, a searchlight in the dark attempt. The surveillance was poor, so the data were too. So our finding, we had our first finding that came out of that meeting. 15 years after declaring superbugs a grave public health threat, the CDC does not know where, when, or how many people are getting sick and dying. The US government lacks a reliable system for tracking and combating these deadly infections. So, we still hadn't answered the question, how many people are dying? Back to the drawing board. So the next question was, who else might be keeping track? Well, each state in the United States, 50 states, also has a public health agency responsible for tracking infectious diseases within its borders. So we sent an online survey to all 50 states, only to find they weren't doing any sort of consistent surveillance either. Moreover, what the states did know about, they kept secret. We discovered that in some states, public health officials were barred by law from disclosing the whereabouts of outbreaks. In other states, they're allowed to disclose, but they chose not to. So we submitted public records requests to force disclosure and shook loose files on 300 superbug outbreaks over just 4 years. In those records, we found that unwitting patients had been checking into those hospitals and nursing homes with active outbreaks, contracting infections and dying, or taking the germs to other facilities. Josiah Cooper Pope was one of them. Born 15 weeks premature, he was in a neonatal unit with an active, uncontrolled MRSA outbreak that would eventually infect every baby in the unit and take his life at 17 days old. Now, in developing these sorts of case studies, we, of course, had to check out what victims told us with as much vigor, with as much rigor as with government and hospital officials. So I asked Josiah's mother for his medical records, as we did with all families. They confirmed he died of MRSA during the outbreak. We also asked families for death certificates, and that's where things got interesting. She had never received his death certificate, so she went to the government office to get it and called me from the parking lot sobbing. The death certificate listed his cause of death as prematurity and sepsis. There was no mention of MRSA, the infection that she had literally watched squeeze the life out of him as he lay in her arms. My heart hurts, she said. I saw what this did to him. We went on to find dozens of such cases in which people died of antibiotic-resistant infections contracted from hospitals, yet there was no mention on their death certificates. Speaking of death certificates, we still were looking for the elusive count of antibiotic-resistant deaths, and while we had come across many cases in which death certificates didn't mention superbugs, in many other cases they did. So we had the idea to analyze death data. Though clearly incomplete, we might be able to get some idea of where, when, how many deaths were occurring. But it hadn't ever been done. The government had never done it. They had a big database of all deaths in the US, all death certificates in the US, but they had never done this, and here's why. The government analyzes causes of death based on a numeric code. Stick with me here. The code comes from a WHO code book developed before superbugs were a thing, before they became a major public health threat. So there were no codes for antibiotic resistant infections. Thus, they didn't get counted. Maddening, right? Well, here's why I'm a big believer in learning the process of whatever I'm investigating, down to the tiny, grim details. And you'll be hearing more about that from Sarah, who just did some amazing work, really getting into the nitty-gritty details, right, of forensic anthropology. So when doctors fill out the death certificate, I learned, they write out the cause of death in words. For example, they'd write out MRSA, and then later a clerk adds the appropriate numeric code. Because there is no code for MRSA, the clerk would add the code for a routine staph infection that's easily treatable by antibiotics. There'd be no indication it was antibiotic resistant. But the words MRSA would be entered into the database along with that, defective code. So maybe we could do a text analysis of the death records to see how many MRSA or any of the other leading superbugs were listed as a cause or contributor to death. Now, because our government's death certificate database is not public, I went to the US Vital Statistics Office with a list of search terms that Yasmin, our bacteria expert, had drawn up, and asked, I begged them to do a text search for us. To my surprise, they agreed. In fact, they were even enthusiastic, which, brings up another important investigative truth, right? It never hurts to ask. You never know. And we found that drug-resistant infections were mentioned as causing or contributing to more than 180,000 deaths over 10 years on death certificates, and that the annual number had doubled over 10 years. And remember, this is almost certainly a dramatic undercount. Even so, states do only about a tiny fraction, about 3,000 of those deaths, and the CDC knew even less. Okay, I'm going to stop there because on this slide, people are going to talk about scientific misconduct and conflicts of interest. And so, Anna, do you want to take over from here? I'll pull yours up while you're... There you go. We can just choose that.
Okay, thanks. Hi, I'm Anna. I'm going to speak about the experiment, or in the English version, fatal experiments. A documentary about the surgeon Paolo Macchiarini, who was recruited to the Karolinska Institute in hospital in 2010. And as Deb said, KI is the home of the Nobel Prize for Medicine and Physiology, a well-renowned university hospital. In 2010, it was kind of a hype around Paolo, because he was famous from an operation from 2008 when he transplanted a donor trachea into a human with his own stem cells. And he was kind of the star surgeon with revolutionary ideas. He wanted to make artificial organs out of plastic seeded with stem cells. And his focus on that time was on the trachea. So simplified, he would put the plastic trachea into a bath with the patient's stem cells. And the idea would be that they would grow into the material, and then when transplanted, the body would recognize its own stem cells and the graft would grow into place. So if this worked, that would be a solution to one of medicine's big problems, to the lack of donations and possible risks with immunosuppression and transplanting other people's organs into your body. So this was really cutting-edge research, and I think that is one of the reasons why this could happen, why everyone seemed to get so blind to what Macchiarini actually did. Because no one of the patients who got this graft, this plastic trachea, is alive today. And for us, it all started in 2015 with a tip to our editor, Johan Bronstad. 4 doctors had accused Paolo Macchiarini for serious misconduct and falsifications in his articles. And their report was solid, and some of the doctors had even been working with Paolo's patients. And they were basically saying the articles don't match the reality, the clinical reality. The method doesn't work. On the contrary, it causes great complications, and the patients are suffering. So this was serious. We read the report, and then even if Paolo said no to other media this year, actually he said yes to meet with our director Bosse Lindqvist. It was soon clear that both Paolo and Karolinska had another completely different picture of this than the doctors. And this was the point where we thought this might be a story, because someone had to be wrong, and either it's the doctors or Karolinska and this star surgeon. But either way, it's quite interesting because it's all happening at home, in the home of the Nobel Prize. So we started to work, and half a year after, we were so far in our research that we thought that even if Karolinska had Paolo's back from the beginning, they would never free him from the allegations, because they were so serious and there was a lot of evidence in the doctor's report. So we were surprised to learn that in August 2015, Vice Chancellor Anders Hamsten freed Macchiarini from the allegations. He said Macchiarini had been careless, but not guilty of misconduct. And this kind of started a new phase for us, because we thought Paolo would be guilty of misconduct, that Karolinska would say he was guilty of misconduct. And now we felt like, okay, this is a really complex field, and we're just journalists. And now we're not just going to say that Paolo Macchiarini is wrong, but also that Karolinska, with all its power in this world, has made a mistake. But when we broadcasted in January 2016, we could prove that Macchiarini was guilty of misconduct, that he had falsified scientific records, and that he gave a completely false picture of his patient's conditions. We could also prove that he never tested these methods on animals before transplanting them into humans. So basically experimented on his patients. And the method didn't work. The scaffold didn't grow into place, and the patients had to go through tough operations with cleaning mucus and granulation tissue from the airway and stenting to keep the airway free. I'm just going to show you real quick. This is a normal airway. This is a healthy pink, soft airway. And this is under Mariam's airway. He's the first patient who got this plastic trachea from Macchiarini, and this was at Karolinska. You can see the white graft, you can see the mucus, and you can see a fistula, a hole right through to his body where bacteria and air can leak out. And this, again, the healthy trachea compared to Anna Mariam's trachea. And this is the same way down to the lung. And you can see it's all clogged up, and it's just a small hole for him to breathe in that circle. So Paolo Macchiarini didn't mention any of this in his article. He called Anna Mariam's trachea an almost normal airway and said that the patient had an improved lung function. So the patients really suffered, and this is just one example. And while gathering this information, we also were filming with Macchiarini, which was a bit uneasy when we started to grasp what he actually had done to these patients. Because we filmed a lot, both me and Bosse Lindqvist, director, and photographer Lars Granstrand. And our aim was to get as close to Macchiarini as possible, to be able to understand him and his motives. But it was hard, and Paolo kept us at a distance. Obviously had a lot to hide during this year, and it was very private, but we were trying to push to get more information as much as we could and as much as we dared, because at the same time we were afraid of losing him. And he did jump off the project once, so it was always an act of balance, trying to get more information and still trying to get him on board. But during autumn, we actually got so close that we were sailing with him in Barcelona on his boat. And it might seem strange putting so much resources to get close to a person you're investigating, but we use this as a method to be able to understand the business through the person, to be able to understand why Macchiarini did what he did, and to be able to give his best arguments and to really show his vision and his version of this story. So this method is effective, we found, but it's special because it's very draining personally, and it also can compromise your personal integrity, because you have to be nice and create this platform where everything is just nice and easy, and be very dynamic, always on your toes. What can you say, what can you not say? And to be nice to a person when you know what the person has done, when it's such serious things, that's not always easy. You get really personally involved. I mean, the whole team were speaking and thinking and even dreaming about Paolo during this year. And I can speak a long time about this, but maybe we'll get a chance to speak more about it later, because I'm trying to hold my minutes here. So I'm just going to finishing off with saying that you can find a story within a story that had been reported a lot already, because that was the case for us. So mostly it had been hailing portraits. It was kind of, the surgeon trying to solve one of medicine's biggest mysteries, that kind of reporting. And there was one German movie who was broadcasted in 2014 that it was very clear. I might be able to talk about it later. We got the raw material from this film, and we found crucial parts that was excluded in their film and that we included in our film, and which was very compromising for Paolo. So when the allegation became known, the reporting became a lot harsher, but there was still a lot of answers missing, and this was a reason why we wanted to go forward in this reporting, even though it was so much out already in the media. So, for example, the doctor's allegations hadn't been investigated yet or proved officially. No evidence showed that Macchiarini's method actually worked. Macchiarini's version of this was missing. The doctor's version was missing. What had happened to his patients was missing. Were they alive? How many were they? What had happened in Russia and what was Macchiarini working on there? And we learned during the process that he worked on more organs than the trachea, so the esophagus, for example, and new organs, and really tried to work on this vision, which only worked in theory. So the participation of the Karolinska Institute and hospital wasn't reported either. And I'm going to finishing off there with my contacts, and this is me on Paulo's boat in Barcelona. So, yeah.
It's there.
Oh, here. Just escape.
Yeah.
There you go.
Thank you. Okay, thanks very much. So I'm Charles Pillar with Science Magazine. I'm going to try to talk about this award-winning story, but also to think a little bit more broadly about investigative reporting in science, in part because although all of us on this panel have had the privilege to be able to devote ourselves for serious amounts of time to a single story, a lot of times folks working in this field don't have that privilege and need to understand how to do smaller investigative stories that would be able to use similar tools but be doable within the structure of your job. So I'm going to try to look at that a little bit. So this story involved looking at questions of clinical trial results, and the genesis had to do with this basic question: how is it that drug manufacturers can get away with producing drugs that are later found to be either harmful to patients or ineffective, and yet make enormous profits on these? Also, clinical experiments involve risks by volunteers, and really what this is all about is to try to create the conditions where evidence-based medicine can thrive. And in the case of this drug, for example, Paxil, GSK's drug was, there was experiments done that had not been publicly disclosed, that the results showed that the drug in teenagers caused suicide attempts, suicidal ideation, and yet this was not really understood by the public or even fully by the FDA when approval was made for this drug. So it was only much later that the information came out, and it led to a lot of concern about why isn't there a good repository of results managed in the United States by the federal government, and also in other countries or in the European Union, other kinds of repositories with similar purposes. So what we did is we wanted to ask a basic question: how well are companies, universities, nonprofits, how well are they providing the required results to their experiments? They're supposed to be providing these results by law so that the public and doctors can interpret the efficacy and safety of the drugs that they're testing. So are they really providing that information? And so to do this, we had to go through a somewhat elaborate coding process to pull the data down from the federal website and to do the evaluation of whether these data were actually providing the information required. Thankfully for me, I had my wonderful colleague, Talia Bronstein at STAT, who has the technical skills to do the coding work associated with this. And it took quite a long time to not just get the data, but to clean it and to understand it fully and to put it through the process of being ultra fair to the organizations. In other words, bending over backwards to know what were their legal requirements even at times when the legal requirements to us fell short of what their ethical or moral obligations might be to share data with the public, we still felt that it was important to judge them on the terms that were, in a sense, the most narrow, so that we could make a clear statement about what we were finding. So what we found is that basically that nearly every organization that's required to provide these results to this federal repository, clinicaltrials.gov, were not doing so. And consequently, the data set was incredibly inadequate, very difficult for patients and doctors and researchers to draw the kind of conclusions they needed to reach about the efficacy and safety of these drugs. So what was perhaps kind of the most surprising in a way is that the worst offenders were the most noble, distinguished universities in the United States. And what we did that was a little bit different than what had been done in the past. So there had been some academic studies of these data in the past, and there had been academics who would say things like, well, there isn't very good compliance, and here's the general information about it. The problem is that academics are so polite, and they're so reluctant to directly name the institutions and the individuals who are breaking the law and endangering patients in the process. But we were much more rude than that. And what we found was that institutions and individuals can be embarrassed into doing the right thing. Who knew? These problems are far from solved. But what we've seen since our story appeared, and not just due to our efforts, of course, but due to the efforts of other institutions and individuals who are concerned about accurate clinical trial reporting, a lot has gotten better. There's been a big, big improvement in the provision of these results from clinical experiments, and much more room to grow, but still better. So one of the things I wanted to mention is that these registries, which include the EU Clinical Trials Registry and national government registries, even in places that you might not necessarily expect good records, like China and Iran and other places that sometimes in the West are not given full credit for their record keeping, they have at least rudimentary registries that are really amazing to look through and understand. The great thing about these registries, to me, is that if you've ever looked at a series of scientific studies written in journals on the same topic, you know that the formats, the conditions, the terms used, the comparison information varies a lot. These trial registries codify and require the entering of information in a certain format so that you can compare studies in a way that you can't just by looking at the journals. At the end of the presentation, I'll give my contact information, and if you want help in learning the steps to take to do this sort of work, I'm happy to provide it. So what I'd like to do now is give a different example. This article that I just described was a huge effort, took months of time for more than one person. But there's smaller stories you can do that use the same sorts of data, the same registry data, that can help you lead to different kinds of stories that are in themselves really valuable for the public to know. So this is an example of a company called Prove Biosciences, which really was making some pretty outrageous claims about what their genetic test could do during the opioid paranoia, not just paranoia, of course, it's a terrible problem in the United States and elsewhere, but the addiction anxiety led to companies that began to try to exploit that with genetic testing. So what I did is I looked at this and I thought, well, let's just look more carefully at what they're saying. So I did, the first story I did on this had to do with evaluating their science. And what I found was, of course, that the real experts in these fields were extremely skeptical. Then I went to the trial registry, and this is where the story really got much more interesting. It's the registry. It's characteristics of the studies that they were working on showed an amazing range of things that are obvious, even to someone who's not an expert in these subjects, to know 100,000 subjects. It's way too many for any normal clinical trial, except in really rare circumstances. The way in which the trial was structured, you can start to see this was not about the science. It was about how you get the money. And so this is not uncommon, especially in the stem cell universe. You're talking about situations where companies are using these registries to confer a kind of legitimacy that they wouldn't otherwise be able to have. And by looking at the registry records carefully and comparing it to other public information, you can begin to see where the outlandish or even the ridiculous kinds of experiments lie and how to expose those. So then, armed with this basic knowledge that their experimental process, the scale of what they were doing, the payment structure, didn't make any sense. It didn't make any sense for a legitimate clinical experiment. It led me to start to look more deeply into their business. And these are some examples on this slide of what some of the issues were that were uncovered. People came out of the woodwork and started coming to me. I'm sure you've all had this experience when you write about something, and then suddenly the people who you wished you talked to before start to come out and reach out to you. Fortunately, in my case, I had a lot of people who came forward and shared their stories of working inside Proof Biosciences. And also, I reached out to doctors who had been their partners and was able to determine pretty much how bad it could get. So this is a kind of a happy ending, in a sense, to the degree that any of these kinds of stories can have a happy ending. After my second story appeared, where I talked about their business practices, the FBI, Federal Bureau of Investigation in the US, drove their panel trucks up to the front door of Proof Biosciences and unloaded all their records into the truck. So the company shut down, and it was a situation where, maybe more vividly than in many of the stories that I've done over the course of my career, you can see a kind of cause and effect. You can see that exposure of this sort of practice can lead to action, not just by the federal authorities, but the company itself couldn't survive because the marketplace for them dried up. People began to understand that what they were selling was not what patients needed. So I want to leave you with a couple of small things. This is what you want to do with an investigative story. You want to get to the vantage point that gives your readers the biggest picture, the clearest picture of the big story that you're after. But you have to be careful. And I think after all of our presentations, we'll have a little discussion of how do you get careful? How do you bulletproof your story and make sure not only that it's right, but anticipate the potential concerns or pushback you might have from the subjects of your investigation. So I want to end, actually, if you'll forgive me, with one more slightly different subject. So this is a story I broke yesterday and in Science Magazine, and it's about FDA enforcement under the Trump administration. So that's the Food and Drug Administration of the United States. And what I found was that in key areas, in this chart, I'm sorry, it's kind of hard to read, it's small, but this depicts the, two measures of enforcement, one called warning letters, and a very important way in which the FDA enforces its law that's required to regulate. And the second is inspections that are classified official action indicated. That means, again, a way of setting up the pipeline for enforcement action to put companies that are selling unsafe or otherwise illegal products on notice that they have to change. Now, I kind of stumbled on this story about 5 weeks ago. And what shocked me about it was that it hadn't already been done, because the data are there, hiding in plain sight, and there are superb reporters crawling all over the federal agencies in Washington, including friends of mine who cover FDA. But I think the lesson here is clear. These are stories that are not so remote and so difficult and so forbidding for a reporter who has other responsibilities. You can find these things. It's about curiosity and skepticism and being willing to turn over some rocks and see what's there. I didn't necessarily assume that what I would find is a story that no one had done on FDA enforcement, but it was there. It was there for the asking. You just had to do the work, and the work really wasn't that complex to do. So I just want to leave you with my contact information. If I can be of assistance in stories that you're working on and would like any kind of advice about that or tips, I'm happy to provide it. Thank you.
Good. Come on. This one is not coming up for some reason. Yeah. It's not coming up. Is it okay?
Yeah, no,
All
I
right.
can just wing it.
All right.
Sorry, hi. I was at the Lindau laureate meeting a couple of years ago, and I watched as Nobel laureates struggled to get their PowerPoint presentations working. So I feel a lot less shame when it happens now. Okay, great. My second confession is that I found out at 10 o'clock last night that everyone else had slides. So you're mainly getting photos, because I want to tell you a story of how I came across this kind of horrific story that I read last night, and I'd forgotten how, bad it was. So my name's Sarah Wild. I'm a freelance journalist, and the reason I'm including this slide is to show that I spend most of my time in deserts or looking at telescopes and geeking out over cool stuff. So when I came across this story about unidentified bodies in Gauteng is the province I'm from in South Africa, I was just so shocked. Now, the way I find stories is that I do things called university tours. This is going to be very practical talk, by the way. I do things called university tours where I choose a university and I say to them, give me a week. Give me a week and dazzle me with what you have. I started doing this when I was gainfully employed. It's become a lot more difficult as a freelancer. But so I'd go into an institution and then I would have this parade of researchers telling me what they do. And one of these researchers was a woman called Erica Lebay, who's a forensic anthropologist from the University of Pretoria in Gauteng, South Africa. And I was sitting with Erica because she was telling me about how you can tell people's race from their bones. Can you tell ancestry from someone's skeleton? And the reason she does that is because she tries to create presumptive identifications for skeletons, for dead people. And I don't know if you can see clearly, but you see all of these boxes behind her. Every one of those boxes contains a skeleton. Every one of those boxes contains a person who's unidentified. And she was so blasé about it. And she said, well, we all know about this. I was like, what? She says, yeah, 1 in 10 people who die unnatural deaths in Gauteng province will be unidentified. Now, as you were all walking in, I was surreptitiously counting you. There are about 120 people in this room. That's 12 people. It's a row. It's a row of people who died in Johannesburg or somewhere in Gauteng, which is just one of 9 provinces, and then disappeared. Their family don't know what happened to them. The family didn't get to bury them. Don't know where their bones are, which is a very big thing in South African cultures. And this is what Erica said to me. She was holding up a skull. She was having a totally like Hamlet talking to Yorick moment. Funny but not. Quote, they took out his face He has at least 10 impacts on his cranium alone. So there is this massive blunt trauma to the head, and in this case, to his hands. They broke his hands as well. But we'll never know who this person is. And if you don't know who they are, you don't know who did it. You can get away with murder in this country. You can just throw him in the veldt, or in this case, down a water pipe. All you need is a brick. So this conversation happened in 2014. As I said, I was gainfully employed. The following year, I was retrenched because allegedly science was a nice to have, and I struck out as a freelancer. And this story never went away, because when she told me about this number, I thought, no, surely not. She's an anthropologist. No, she's got the number wrong. And so then I thought, okay, well, how do I find out the number? Because that was all I had. So I went to the police. The police refused to give me any information. So what I did, and this is also very useful information if you're trying to deal with your city council, is I set a reminder that every week a little light would flash and I would know that it was time to email the police. I emailed them 23 times over 18 months. They were so sick of me. But there's a delicious delight in when people are paid to be public servants and refuse to help you. It gets my brain going. Same thing as street lights out. So I had this reminder, and it was all documented as a paper trail. So I can give you the number 23 times because I have this paper trail of what I did. Then, as a freelancer, I was sitting, with the story. I knew there was something there, but I needed to investigate it. There was this string that I needed to look at. I needed to look at the numbers of, was this actually happening? How could it happen? CSI told me that it's very easy to identify people. And then what do we do with the bodies? What is this process? But I also had bills to pay. So I was writing my freelance stories at the same time with the weekly reminders going off. And then I thought, okay, well, if I pitch it, then it'll motivate me into action, because there's nothing like a deadline to galvanize a journalist into action. And in South Africa, the going rate is 3 Rand a word, which is 20 US cents. And I pitched it to newspapers, and they said, yeah, sure, but you can only write 1,000 words. So that would be $200 for an investigation. And I was like, if I do this, there's no way. I can't do this properly. I tried internationally, and then people thought, well, it's too local. So I had to get a grant. This story would not have been possible without the Taco Caper grant. Because as you can see, there's already now a lot of effort going into it. And I proportioned like a slice of time each week to keep it going. And then I set an alert on my on my Google, looking when unidentified stories would come up, or people who are working in forensic science, so that it could keep it fresh in my mind. Then where I went was when I got the grant, which was fantastic. Went home, had a whiskey, brilliant, so that I could finally tell this story. I then tried to get into the mortuary, which was a truly harrowing experience. I had a collaborator on this, Kristen van Schie, who was my photographer, and I can heartily recommend, if you are doing a big investigation, to choose someone to collaborate with, because you can look at projects from different angles, you bring different things to the table, and you can bounce ideas off each other. And in this case, you can support each other emotionally, because I don't think we talk about the kind of damage these kinds of stories do to us as reporters. So Hillbrow Mortuary sees 3,000 unnatural deaths a year. The people I was talking to will do 4 autopsies a day, and 1 in 10 will be unidentified. And the reason that this happens, this great failure of science, is that you have a forensic system that is grinding to a halt under sheer numbers. I don't think people in Europe can grasp the sheer numbers that we're talking about. I mean, Gauteng province alone will see 16,500 unnatural deaths a year. So we got into the mortuary. The way we got in was through scientists and through medical professionals based at universities. Because if you go through government, I do believe it is their job to try and obfuscate and to say no in as many different ways as possible. So often your route in is by people who are already embedded in the system. And I've found that scientists are generally more willing to help, and people based at universities. That is eventually how I got an interview with the police. It was through another forensic anthropologist who opened the door for me. How am I doing for time? Am I good? Ah, sweet. So that's how we got in. And we saw horrific things. That's why I really do feel the need to underscore that you need support systems when you talk about this, because you see people carried in on sheets and then bodies decomposing because they've been there for so long, because people desperately, the people who work in the system want bodies to be identified. But the thing that people often don't realize about countries within Africa is that most migration of Africans happens within Africa. South Africa is home to the largest number of immigrants on the continent. So you have people coming from Tanzania, Malawi, Somalia, and they're coming down to South Africa and dying there. They're sometimes illegal, and we have no way of identifying them. Because if you look at the troika that CSI tells us will fix everything, you've got DNA, which breaks down in sunlight and water. You've got DNA, teeth. Most citizens in African countries, you don't have dental records, and fingerprints, which is soft tissue, which is one of the first things to go. So what do you do? Which is why I turn to the scientists to ask them how they do presumptive identifications. So while this could have been a state failure story, quite easily, I chose to angle it as a science story to answer the question of why is the system not working and what can we do to improve it? So now within Erica Lebay, I can't go back, Erica Lebay and her team are looking at ways to create presumptive identifications, to create databases. So for example, with this high statistical probability, they can tell you who is a white South African. They can tell you whether the person was white or Indian, black or colored, within a statistical margin. In South Africa, those are designated racial terms. Colored is not a derogatory term, it is an actual racial category. But you can't tell within African or black whether someone was from Zimbabwe or Malawi or Somalia or a South African. In order to do that, they need more data. So from there, we've now looked at the science, we've looked in the mortuary, we've finally managed to speak to the police, and then it was following the next line of the story, is where did the bodies go? We did this by making friends. I can't underscore how much being polite and friendly, it'll get you incredibly far. It'll get you not just into the door, but possibly into the kitchen area of whatever building you're trying to get into. And that happened with us, with the city parks, who oversee the graveyards. Because then we thought, well, the bodies have to go somewhere, so try and get hold of the people in the graveyards to see how many people get there. And that's when we attended a pauper's burial, which involved 30 children, about that size, you can see them in the background, and 10 adult-sized bodies. And they would stack them in the graves. And when we left, everyone said, no, we know there's a piece of paper, you can check and see, well, this person is in that grave. That just does not exist. By the time we left and when we went back, there were no markers. The chances of these people ever being found are zero. Well, not zero. There's a tiny infinitesimal chance that we have to hope for. So that's the trajectory of how this story happened. There are some good news in terms of the Red Cross doing work in South Africa to bolster the scientific capacity to identify people. But it's also a story of how science isn't enough. Science belongs in a system. It is one tool among many that we use to solve problems. And now that I've thoroughly depressed everybody, here are my details. And And yes, just because it doesn't have a happy ending doesn't mean the story isn't incredibly worthwhile and that these people need to have their stories told, because they can't. Yeah.
Thank you. Okay, now I'm going to ask you a few questions, and I'll try to alternate with folks out there who might have questions. I'll start with a question for the group. If you take your microphones to have just, we talked about, everybody kind of talked about independent verification of information. It's a hallmark of investigative reporting, right? We don't just report what people tell us. We take steps to determine if what they say is true. So how do you do that when you're investigating something that's so complex as science? I mean, we're not scientists, at least most of us. How do you vet information on complex, highly technical topics? Who wants? Anybody start? Charles?
Sure. For me, there's a lot of tests I use for my information, and it depends if it's documents or people. But just to take documents first, for a lot of stories that I do, documents are leaked to me, and it's wonderful to get a trove of information in your email or in the postal service, but you have to be very careful that these are genuine documents. So just to give you an example, from one of the stories that I discussed, this Prove Biosciences story. So I had employees of the company feeding me documents, thousands of pages of internal documents from the company that suggested really serious wrongdoing and really serious problems with their genetic testing. But I had to be very careful in understanding whether these were genuine documents. Now, I should say, afterwards, the company threatened to sue me and didn't. And then the former CEO of the company has been out giving talks accusing me of inventing these documents, but has never said that to me because I didn't obviously invent the documents and he had no legal claim. One of the ways you do this is you have a common sense test, which is that it's easy to fake 1 or 2 pages or 10 pages or even 50 pages of documents in a certain way. But at some point you reach a critical mass where it becomes extremely difficult for these documents not to be genuine if there are so many examples of them. Second, show the documents to the people, independent people who are in a position to know their authenticity. Share them and get opinions on them. And third, give the documents to the subject of the investigation, if feasible, and get their feedback on it. And so by going through all those steps, I was able to authenticate what I was doing for documents. So I'll stop there. I have some thoughts about people too, but I'll let the others take over.
Mine would be, in terms of documents, if you are able, in South Africa, we have the Promotion of Access to Information Act. So once you have the name of the document, you can try and get it from government to check the two, but that's sometimes difficult if it scuppers your investigation. Giving it to the source, but ensuring that it can't be traced back to the source, because that is often the most difficult part, when you have to anonymize it in such a way that there's no metadata. I often do that by exporting it as a PDF and ensuring that the source's fingerprint is never on it. When it comes to a source, I'll break it down into the facts that they're claiming. So, for example, you can't fact-check how they felt about something, but you can fact-check whether they said an event happened. And I'll usually try and get other sources to corroborate that it's in fact true. Yeah.
We do the same. We call it, and especially we do it before broadcasting, we call it line by line. I'm not sure if this is the thing. So this is one thing we're doing when we're broadcasting, but we're also doing it during the process. And for me, I'm not a science journalist, I'm an investigative journalist, and I work with several fields. So for me, diving into complex subjects as tissue engineering and as in this case, It's just to take the time, I think, for me at least, that just to read, to speak with people, to question people, and also maybe quite often I do that. I'm not clear with what I'm doing to the person I'm speaking to at the beginning. So I'm testing the person before telling what I'm actually doing and what I'm investigating. And that's also a way of testing the person: is he or she legit? Is he or she does he or she have any conflicts of interest, and what are his or her capacities, and also to always remember that groupthink exists even in our world, right? So I'm going to take this as an example. I mentioned earlier this film Supercells, who were broadcasted in 2014. They started to follow Paulo in 2012, and they were with him this very important journey when he was transplanting, and the Mariam and several other patients as well. And when going through the raw material which we bought to be able to use in our film, we saw that they have excluded crucial parts. So, for example, one scene where Paulo is walking on the beach, we show it in episode 1, and he's speaking about the transplant not working. So he's aware it's not working and that it's too soft, and the Mariam's transplant, the one I showed you here before, his trachea. But he still decides on going on with the new operations. So he knows that the first trachea wasn't successful, it wasn't working, and he knows there are problems with this new one, but he still goes on and is doing the operation a couple of weeks after. So that's really just an example on how we as journalists also can be forget all these fact-checking and maybe get blind as well, of the same reasons in this case that Karolinska got blind, as sci-fi field, cutting-edge research, and a charismatic superstar in the middle. So, yeah.
Charles, you had something you wanted to add about people.
Yeah, so I think already there's been some great suggestions about how to think about, how to evaluate what someone's saying. For me, one of the things that always comes up is, does this person have an agenda? Do they have something that they're trying to manipulate you into describing in a way that's beneficial to their particular position? And so for me, what I try to do is to see the similarity in what sources are telling me who don't know I'm talking to other people. So if I'm hearing the same thing from 2 or 3 or 4 different people who are in a position, in theory, to know what they're saying, and I'm hearing something that seems to be a consistent story, and I know that they're not talking to each other because they don't know who I'm talking to, it's a good way of validating that story as being legitimate. The second thing that I would just say regarding thinking about the position of scientific subjects, I think the point Anna made about groupthink is really an excellent one. What I've found that has been so surprising to me in some of the stories that I've worked on is that really well-accepted ideas about clinical treatments and other scientific issues are based on incredibly thin evidence. Evidence that, to me, looking at it, just looking at it with fresh eyes, can see that it's outrageous that some of these things are being described and accepted by a wide range of doctors and patients as gospel, when the actual underlying information that you can easily understand by reading the studies line by line and reading the data carefully, you can see how thin it is and how weak the evidence is. So you have to take that into consideration when you're thinking about someone's veracity. Yeah.
When it comes to talking about science, and because we can't all be experts in other fields, so I'm a physicist, so I needed to have a lot of the biology, I needed to teach myself a lot of the biology. I phone a friend. This is like, I have a number of people like this who I know, who are often professors or experts in their field, who I can never use as sources because they're friends, and I will ask them, usually more than one of them, just to double check. Someone might have had too much wine, just to make sure that, to put me on the right track or point me in the direction of the latest thinking, which does help it if I'm like a complete newbie to a field.
Yeah, the panel of experts, your own panel of experts you assemble. Questions out here? Any questions? Yes, I'm not sure, where are the microphones?
There are microphones down at the bottom.
Oh, at the bottom. If you want to shout it out, I will repeat your question.
I have a question for Anna. How did you find the whistleblowers, and how did you prove that the doctor falsified records?
Anna, how did you find the whistleblowers? How did you prove that the doctor falsified records? And I'll add one to that. When did you first approach the doctor you were investigating in your investigation?
Okay, so first, how did I find? Did we find a doctor? So we got a tip from a colleague of them to read their report. So basically, that was it. So we saw they had accused Paolo and made these allegations, and we contacted them, but they were really afraid actually to be. We interviewed them late. But they were very afraid during this year. They were very afraid of saying what in media what they had found, because they were afraid of losing their jobs and that kind of things. So that was the short answer for number one. And number two, now I have Paula in my head. So what was number two?
How did you fact check them?
Yeah, fact check them. So we went through the report. This is a very long process, obviously. So we started with trying to get into this complex field with reading a lot, speaking to experts, and all that. And then we read the report. We learned the vocabulary to be able to understand what it actually said, the articles. And then we got films from operations, and we could see the biopsies, and we could see Anna Maria's throat. And I mean, the evidence I showed for you here with this clogged trachea, you can see for yourself that it's just a small hole to breathe through. But I mean, that was so graphic, so that was the most easiest part, if you might say that. But it was really take help from experts and learning yourself. And as you said, also when we read the articles, it didn't make sense. I mean, we could see, for example, that it wasn't an almost normal airway. When we could see, we can compare the records to the article and see. It didn't match up. So, for example, is it fungus here or is it not? So we could check the records, but this was really a long process, and we used Excel to be able to, just point out investigations on Anna Maria, 3 months, 1 year, and see that it didn't match up. So that's basically the very short version of it. Yeah, did I answer your question? Or and then Paolo, we reached out for him very early in the process, or Bosse did, our director. So that was in January, I think, or February, or something like that. And he said no to other media, as I mentioned before, but he said actually yes to meet Bosse.
Why did he say yes?
I think it was Bosse knew one person at Karolinska a bit, so I think that was one reason. But also Bosse is very good at. I mean, if he gets to speak with people, he get a good contact. So it was just, we really want to try to get your side of this story. We're really gonna want to show your version of this. And as you said before, Sarah, you really get far by being nice. So Bosse was really nice to him and just said, we want to paint the whole story. We just want to show your vision and your version of this as well. So, and also they made a deal not to speak about the allegations before Karolinska had made their decision. So that's also a reason why we were so nice and didn't speak about the allegations and tried to get the information about his research and all that, but still, try to keep it nice and at a nice level. So it was early in the process, and then I started to film with him during summer.
Okay, so I wanted to say one more thing before we break up, and that is Global Investigative Journalists Network. Tremendous resource for tools, tips, contacts in the journalism community for help on big projects. You might be juggling a lot of, busy beat. You can find a network of people who can help you out, who can give you tips on where to find information, such as Charles. And are you guys on the network? Global, everybody, right? Yes. GIJN.org. And the next Global Investigative Journalism Conference, we meet every 2 years, is September 26 to 29 in Hamburg. Thank you for your attention. Thanks for inviting us, and we'll see you out there.